Mr. Chairman, I have been watching the narrative that Ms. McCarthy has been given as far as the CPP, and I noticed it changed somewhat in August and in late July from global warming as to the effects of the CPP or the effects of carbon-2. She then went to say that it's going to exacerbate childhood asthma. And so I've been looking at this from a physician point of view, and I've really made no connection between CO2 and child exacerbations of asthma. I've treated thousands of cases of it, and I know from a fact that most of childhood asthma is either tobacco smoke or rhinovirus, or seasonal due to pollen or dust. So I guess my question to you, Dr. Smith and Mr. Magness, what are the health disbenefits of this CPP? For instance, are my seniors in my district, and certainly I live in a very rural district where unfortunately we have a disproportionate people on a low fixed income. So are the poor and the seniors going to have to choose between medicines and higher electricity costs to afford medicines? Because if they do, that affects the health directly. I can make that connection much more easily than I can with the other way with the CO2 and the asthma exacerbations. Yes, sir, Dr. Smith.
Thank you. I'd just like to repeat, as I said in my oral statement, that those asthma attacks that you're referring to have nothing to do. They really have nothing to do with climate change.
And I agree. I think
neither in the present or the future. EPA has based them entirely on changes of coincidental changes of other types of pollutants that are already regulated, and those other pollutants are already regulated to levels that are protective of the public health. So it's really not a credible case for arguing that there would even be those benefits to be had as these other pollutants fall coincidentally in the implementation of the CPP to get the CO2 down. But they have nothing to do with climate change. Now, at the same time, you raised the question, are there some other kinds of disbenefits, health disbenefits even, that may be incurred as a result of the CPP? And that would, as I said before, there are statistical associations found between disbenefits in health and increased spending or costs to consumers. And so those would be real as well. They would be just as real as the statistical types of calculations that are lying behind the asserted benefits of the CPP. EPA has not calculated them. And as I said, if you compare costs to benefits, you end up with the impression that the costs are actually greater than the benefits, which would imply that there are these health disbenefits also to be had from those costs.
Mr. Magness, you have something to add, sir?
Mr. Abraham, if we're not able to provide reliable electric service, that service is fundamental to people's way of life day to day. The way in which a grid operator protects the grid from blackouts, from a much, much worse situation occurring that could go on for a while, is to do rotating outages. We don't like to do them, but it's one of the tools we have. What we see in our analysis is that if we are not able to get the transmission lines built in time to replace the coal units that are lost, we could see particularly localized effects in places like Dallas, places like Houston, that we may have a higher and higher risk of having to do rotating outages. When we do those rotating outages, they're not something that you can plan very much in advance because of the nature of the electric system. They affect hospitals, they affect schools, they affect where our elders are cared for. So I think from the highest level, one of the reasons that electric reliability is so essential is the day-to-day health and operation of people and of our economy.
Thank you. Thank you, Mr. Chairman. I'll yield back.